Good afternoon, and I'd like to welcome each and every one of you who aren't from our fair city to Blair County and to my hometown of Hollidaysburg. I want to thank everyone for being here and thank Thompson's Pharmacy for their hospitality. This is not only my hometown, but this is my pharmacy. So it's exciting that we have this here today. I am so pleased to be joined by Governor Josh Shapiro, Commissioner Mike Humphreys, Representative Benham, and others to promote the significant achievement that was House Bill 1993. In the Senate, I work closely with Senator Christine Tartaglione on Senate Bill 1000, which is the Senate's version of House Bill 1993. Our offices also worked in consultation with the key stakeholder groups, bringing critical relief to pharmacies across Pennsylvania. I'd also like to commend my staff, Nathan Akers, Greg Beckenbaugh, and Matt Deegan, along with Chris Donahue and Jordan Grant, and other Senate Republican staff for their tremendous work on pulling together this final product. In many areas of the state, especially rural areas like here in Blair County and the rest of my legislative district, pharmacies are a vital part of health care and a health network. These pharmacies are on the front line of health care and are often the first stop for people looking for care. But these pharmacies are struggling as more and more continue to close because of the unfair practices of PBMs, or pharmacy benefit managers. This legislation addresses these issues as well as provides for transparency and accountability measures to ensure that pharmacies and PBMs are on a fair and level playing field. At a time when our community pharmacies could not wait any longer, the General Assembly answered the call and passed meaningful PBM reform that would bring much needed relief to pharmacies in rural areas and across Pennsylvania. I'm proud of the reforms we were able to pass in House Bill 1993 and will continue to be a strong advocate for community pharmacies moving forward. I would also like to recognize Representative Jim Gregory and Representative Jesse Topper for being here today. And now I'm going to introduce Bill Thompson. Bill Thompson was really the first person when I came into the legislature to talk to me about the PBMs and how it wasn't a fair playing field. And I could not wrap my brain around this. I said, you pay for the drugs, but you don't get reimbursed for the full amount. How does anybody run a business like that? He said, that's the point, Judy. So I'd like to represent Bill Thompson of Thompson's Pharmacy.
Thank you, Judy. And I'd like to say that Judy has been more than a friend through this whole process. She listened to me when we started this process, and we've been at it for, I'd say, 5 to 7 years. And she's the only one, other than my friend Jim, Gregory, and Lou, and thankful for other PA delegates that have been through our process, but they listened. And we're finally at a point, and that's why this gentleman's here beside me, that we're going to finally get something done. And that I can't thank enough to these people behind me, especially Insurance Commissioner, Representative Jesse. I can't thank you enough. As a result of bipartisan support, both of our parts of the legislature and Governor Shapiro's administration, there has now been passed. Many thanks to our listening to your community pharmacy and constituents of Pennsylvania. We still have work to do to ensure the long-term viability of independent pharmacies in Pennsylvania. We cannot have any more pharmacies, community pharmacies, closed in the state of PA. There's almost one a day closing right now. One a day. Hard to believe. But we're proud to be here, and that's the reason why we're here. The PBMs are one-sided and unilaterally imposed on both our community pharmacies and our patients. We believe this legislation will help send the tide of independent pharmacy closings and provide our Pennsylvania pharmacy patients and the right to choose their own pharmacy. Community pharmacies do the extra that our most vulnerable patients need to stay healthy and out of the hospital. Whether it's compliance packaging, home delivery, or extra time discussing the medication, our community pharmacy is always there for you. As a result, access to quality health care is very important to our community, to our patients, and our pharmacies should suffer less harm by this bill being passed today. I would like now to introduce Representative Jess Benham, and thank you for all your support, Governor. Thank you.
I want to thank Bill and Thompson's Pharmacy for being such wonderful hosts today, and I especially want to thank Senator Ward for her wonderful bipartisan, bicameral support of this legislation. That cooperation is the reason why we're able to be here to celebrate today. Our locally owned pharmacies are trusted community institutions. They deserve a level playing field with the big corporate chains, which is a fact reinforced as I've spent the last 9 months traveling the Commonwealth hearing from pharmacists. In rural areas, small towns, suburbs, and big cities, every pharmacist told me the same story. Pharmacy benefits managers were rigging the system in favor of their affiliated big chain pharmacies, while at the same time raising the costs of prescription medications for patients. As a result, over 140 pharmacies have closed in Pennsylvania since January 1st alone. The PBMs have been putting our pharmacies out of business by underpaying them for prescriptions. And when 3 PBMs control 80% of the market, we're dealing with a monster of a vertically integrated monopoly. But I was not afraid to take them on. Because Pennsylvania is not a haven for corporations that want to make a quick billion on the backs of patients and our beloved local pharmacies. Our community pharmacies provide a level of service unmatched by the big chains. They know our names when we walk through the door. They sponsor our kids' sports teams, they march in our parades, and so much more. That's why I introduced and championed this legislation. And it's why I've been fighting the predatory PBMs even before the governor mentioned them in his budget address. It's why I've spent all this time building consensus with members of both parties in both chambers throughout the Commonwealth. And it's why I'm grateful our governor was willing to sign it into law. My bill stands between local pharmacies and certain bankruptcy. I've known pharmacists who've taken out second mortgages, who've liquidated their retirement accounts, but the theme has still been the same: 1 to 2 years, and they'd close. My legislation gives them much needed breathing room. It requires that they're reimbursed the same amount as the PBM affiliated pharmacies. It gives the insurance department critical oversight and enforcement tools, and it provides powerful patient protections so that you can use the pharmacy of your choice and you aren't forced to order your prescriptions by mail if you don't want to. Our independent pharmacies step up big time every day in our communities, and we're repaying them by making this system fair. We're giving them the ability to continue to serve our neighborhoods. I'm proud we did this in a bipartisan way, and I'm grateful for Governor Shapiro's support. It is now my honor to introduce Joe Breton, the owner of Northern Bedford Pharmacy. I had the opportunity to visit his pharmacy earlier today and cannot speak highly enough of the level of service he is providing to his community. Now, pharmacies like Thompson's Pharmacy and Northern Bedford Pharmacy, we can't afford to lose them. And that's why I'm thrilled about this law and why I'm glad I get to introduce Joe. Thank you.
Thank you. Thank you to Representative Benham, Senator Judy Ward, and all the representatives and senators that fought for PBM reform. And I'd like to thank Governor Shapiro for signing Act 77 of 2024. I also want to thank Heather Kuntz and all the reporters, journalists, and media that helped explain the complex PBM abuses and their negative effects. And I lastly like to thank Bill Thompson's and Thompson's Pharmacy for making today happen. Community pharmacies play a vital role in our patients' healthcare team. This is especially so in our rural and medically underserved areas, such as Northern Bedford County, where my pharmacy, Northern Bedford Pharmacy, is located. As the most accessible healthcare provider, my patients trust my staff and I for medical information and advice. In rural areas, the lengthy distance to hospitals and other higher-level care can serve as a roadblock for some to seek needed medical care. Many times we are there to urge and reassure patients that they do need to go see a doctor or go to an ER or urgent care, and it is worth the 15 to 20-mile drive. We have patients come to us with injuries such as a cut on the face from a line drive to respiratory infections, asking if we have what they need to help them or if they need to seek further medical care. And as a pharmacist, we can be that trusted source of information. Having convenient access to quality pharmacy care is very important. How many times have any of us been out running errands, and when we get home we realize we forgot one of those errands, even something as important as picking up a prescription? Imagine if that was you, and then you had to turn around and drive 15 miles back to the pharmacy because I had to close the doors to my pharmacy due to PBMs. I know many people, myself included, would think, do I really need that medicine today? Keeping pharmacies open in rural areas helps people take their medicines daily and prevents more serious medical complications. With about 150 pharmacies closing in Pennsylvania this year alone, what happens if my pharmacy's next? Does that teenager who took the line drive to the face not seek stitches, but rather try to take care of himself, which does happen, and develop a skin infection? Or does the person who forgot their blood thinner think I can get it later, missing a day or two of medicine and suffer the heart attack? Act 77 is a great start, but more work needs to be done to ensure our pharmacy's viability in the future. Thank you. Now I'd like to introduce Commissioner Mike Humphreys.
Thank you, Governor, for your leadership on this issue. Representatives Benham, Senator Ward, Representatives Topper and Gregory for getting this bipartisan bill done. And of course, Bill Thompson and Thompson Pharmacy for hosting us today. Before Act 77, PBM regulation meant a $35 fee and a welcome to Pennsylvania. Not anymore. Act 77 gives the Pennsylvania Insurance Department the tools to regulate PBMs and certain predatory practices. It contains several provisions aimed at protecting Pennsylvanians and our local and independent pharmacies. First, the Act prohibits a PBM from paying independent pharmacies less than the amount that the PBM reimburses its own affiliated pharmacies. And it requires that a PBM pass through at least 95% of any drug rebate to a health plan. Second, the Act places strict regulation around patient steering, which is when a PBM requires a patient to buy meds from one of its affiliated pharmacies. Third, the Act prohibits PBMs and insurers from clawing back extra money that is higher than the cost of the drug itself. For instance, if you're prescribed a drug that costs $5 to buy out of pocket, you can't be charged more than that $5 at the pharmacy, even if your copay is $15. Finally, the Act imposes new reporting requirements on PBMs that will allow PID to better track a PBM's actions and sheds light on the movements behind the scenes. Beginning in 2026, PBMs must submit an annual transparency report that will show us at PID the amount of all rebates that the PBM received from drug manufacturers and did not pass through to health insurers, and any difference between what it pays an affiliated pharmacy and other retail pharmacies. Act 77 gets a lot done for Pennsylvanians and for our pharmacy partners. And at PID, we're excited to move forward with its implementation. So thank you again for the opportunity to be here, and I will now turn it over to Kathy Kilgore, a longtime pharmacy customer. Thank you, Kathy.
Hi, everyone. Just want to let you know that Thompson's has been my pharmacy for many, many years. Actually, Billy was instrumental in diagnosing my illness, and I go to a specialist, and the specialist retires. The first thing I did is ask Billy, on this list, who should I go to? You don't get that at Walgreens or Rite Aid or CVS. You just don't. They know your number. You walk in, but all these guys are great. They know you when you walk in. Have a question about how to take the med. They're right there beside you, telling you how to take it, and they're going to make sure you're doing well. So I can't thank you enough, Billy. So, and it's my pleasure to introduce Josh Shapiro. And thank you so much, sir.
Thank you. Thank you, Kathy. Thanks, Kathy. I'm not sure why you need any of us with Kathy here. She summed up just how critically important these neighborhood independent pharmacies are. And Kathy, I want to say thank you for being here. Thank you for sharing your story with us. And thank you for sharing the stories of love that you get when you walk in here to Thompson's. I want to say to Bill, to you and your entire team here at Thompson's Pharmacy, thanks for hosting us today. Thank you for allowing those who have not been in this pharmacy to come in and see the wonderful job you do and the family atmosphere and the warm and welcoming atmosphere that you have. And I know the same is true, certainly by reputation and based on what Representative Benham said at Joe Breton's Northern Bedford Pharmacy. It's a similar deal. You want to be able to go into a place where, what was the old Cheers song, where everybody knows your name, right? And where you're able to have a conversation with your pharmacist and see your neighbor and have that level of positive interaction, particularly in rural communities where these pharmacies are hard to access. So I want to really just say thanks to Bill and Joe for showing all of us the love they have for what they do and the community that they serve. They really, really matter. Our pharmacies really are the linchpins in our communities, delivering the medications and the services and the healthcare that people need every single day to live healthy and productive lives here in the Commonwealth of Pennsylvania. Folks being able to live healthy and productive lives took a great step forward thanks to the leadership shown by Representative Jess Benham and by Senator Judy Ward. These are two outstanding public servants who came together to get something done here in Pennsylvania, Republican and Democrat alike. And what you heard in each of their remarks earlier was actually the same message. They showed up at their pharmacy. They listened to Bill. They listened to the other pharmacists that they met across the Commonwealth. And then they took what they listened and they went back to the halls of power in Harrisburg and they did something about it. And you know what? That's great public service. And I think it's incumbent upon all of us. I don't care what your party is, what your view is, whether you agree on this issue or that issue. We should celebrate that. Public servants listening to the community and then coming back to Harrisburg and doing something about it. And so I really wanted to say how grateful I am to be here with Senator Ward and Representative Benham and to thank them for all their work. And Representative Benham particularly for your work traveling all across this Commonwealth, well outside your district, and listening to people share their stories, particularly from the independent pharmacists, about how PBMs were negatively impacting their lives. So I appreciate you, and I think it should be lost on no one here that we have a bipartisan group standing here talking about something that is really common sense. And I hope you also take note that they are here representing the nation's only divided legislature. Think about that for a minute. The Senate led by Republicans, the House led by Democrats. Yet we've been able to come together on a number of historic common sense things, most notably here today, PBM reform. That coming together, that's the Pennsylvania way, and that's the way we get stuff done. As you heard from Bill, our local independent pharmacies, they're just beloved in the community, and I can tell you firsthand that that's very real. Since I was a kid, I went and got the candy I needed, maybe sometimes the greeting card I needed, and certainly the prescriptions I needed at a place called the Abington Pharmacy. That's in Montgomery County. And when my family and I aren't at the governor's residence and we're back home in Montgomery County, we still go there. I was joking before to Joe, he's blessed with 5 kids. I'm blessed with 4. Lori and I are blessed with 4. We sort of went through that circuit of getting amoxicillin basically every day for one of our kids who had an ear infection. And each day I'd show up at the Abington pharmacy. The pharmacist would say, "Which kid is it now, Josh?" And I would tell them which kid had the ear infection, and they would wish us well and make sure we had what we needed. That's what an independent neighborhood pharmacy is all about. They make you feel warm and welcome, and I'm someone who has experienced that firsthand throughout my life. And I'm also committed to making sure they're able to thrive in communities, rural, urban, and suburban across Pennsylvania. But for too long, we've had these PBMs, these middlemen between the drug manufacturers and these pharmacies, like the one here in Hollidaysburg, who got caught in the middle. And when they were in the middle, what they did was they manipulated the system, and they profited off of the pharmaceutical system at the expense of Pennsylvanians, at the expense of consumers, and certainly at the expense of our community pharmacies. Here's what they've done. Over their time operating here in Pennsylvania, PBMs have driven up prices. They've unilaterally changed the terms of contracts with pharmacies, and they're left really defenseless to that. And they've been picking and choosing who gets to win and who is going to lose. While the middlemen got rich all these years, independent pharmacies were the losers, and consumers were too. Think about this. Since January 1st of this year, 70 independent pharmacies have closed their doors in the Commonwealth of Pennsylvania. This has most notably hurt rural communities across our Commonwealth, and it makes it harder for Pennsylvanians to get access to the medications that they need. 21 out of Pennsylvania's 67 counties have fewer than 10 pharmacies. And in these large rural counties, that means longer road trips to get what you need, perhaps longer ride shares to get what you need, and oftentimes it shuts people out from getting the medication that they need on time. Local independent pharmacies keep getting forced out of the marketplace because of the greed and the conduct of these PBMs. And the good people of Pennsylvania keep getting screwed with higher costs and reduced access to the medications that they need. And during all of that, PBMs, they got richer and they made record profits. Well, we don't want to stand for that any longer. And so my administration and lawmakers from both parties came together to do something about it. I called for reform back during my budget address in February. And Republicans and Democrats alike, representatives and senators, stepped up and answered that call. This bill that I'm about to sign includes landmark reforms sponsored by Representative Benham to stop these PBMs from screwing over Pennsylvanians. Now, apparently, you can't just write in a bill, "Hey, PBM, stop screwing over Pennsylvanians." You actually have to have a lot more words to it. And the words in this bill demonstrate a real commitment to reform and will bring about real change here in Pennsylvania. First, PBMs have been harming Pennsylvanians by dictating which pharmacy you could get your medicine from. This was called steering, where PBMs would steer customers to different pharmacies. Oftentimes, it was favoring the chains that actually own the PBM. So rather than getting your medication at a local independent pharmacy like Thompson's, you'd have to travel further from home and do it on their terms instead of yours. This new law puts a stop to steering in Pennsylvania. Second, PBMs, as you heard before, they have been artificially inflating the cost of a medication. So a drug that costs $5, because the PBM would set the price, not Thompson, the PBM, they'd set a price at, say, $20, and they'd pocket the $15 in profit. No longer will that be the case. This bill puts a stop to that predatory practice as well. Third, you heard from our great insurance commissioner, Commissioner Humphreys, that we now have given him the tools, as the person who oversees insurance in Pennsylvania, to hold these PBMs accountable. You heard before, they'd pay a $35 fee and they'd basically get to do whatever they wanted in the Commonwealth. No longer is that the case. In addition to having the power to hold them accountable and stop them from screwing over Pennsylvanians, we now have greater transparency, greater data sharing, so that if they get out of line going forward, the commissioner can hold them accountable or come back to great leaders like Senator Ward and Representative Benham and call on them to bring about amendments to this new law if necessary. That transparency is really, really critical. Listen, I'm proud to stand here in Blair County today and tell you that these reforms that I'm about to sign into law, the industry hates these reforms, which means we all did something right here. And that's something that we should celebrate. You know, after I announced my call for PBM reform in February, a bunch of these, CEOs from the PBMs came to visit me, and they made their case. They tried to explain why their practice of screwing over Pennsylvanians is something that we should allow stand. As you can imagine, I did not receive that information well, and I sent them out of my office. And these lawmakers worked hard to build a coalition to pass meaningful reform. And today we're here in Blair County to sign that. The people over the powerful. The people won, and the people deserve to be heard, and they were. Here in Pennsylvania, we have shown routinely that we can come together and we can get stuff done for the good people of Pennsylvania. We've also shown that we can actually solve problems, like this PBM problem that has existed for a long time. Democrats and Republicans have been coming together in Pennsylvania to solve other problems too. On higher education, Representative Topper is here, one of the leaders in the Republican caucus in the House, who joined me and others in saying we could no longer disinvest from higher ed, but we also needed to make real reforms in higher ed. And so for the first time in 30 years, we passed meaningful reform when it comes to higher ed. That's a big deal. For more than half a century in Pennsylvania, the Pennsylvania State Police were getting their funding out of the same line item that funded our roads and bridges in Pennsylvania. I don't know who thought that was a good idea way back when, that public safety would have to compete with public infrastructure. Folks talked about this for decades, decoupling that. And you know what? Democrats and Republicans came together last year, and we did decouple that. And now we're investing an historic amount in our Pennsylvania State Police and more money than ever before in our infrastructure, particularly rural infrastructure in Pennsylvania. We solved that problem too. When a court in Pennsylvania said that our K-12 funding system for education was unconstitutional, both because we weren't providing enough resources to our schools and because we weren't driving those dollars out to the schools that needed it most, Democrats and Republicans came together in this budget and not only passed an historic amount of funding for our schools, but we actually put a new formula in place so the dollars would go to the kids who need it most. Solving problems, coming together. I remember hearing from a public defender in a rural community here in Pennsylvania who said we were one of only 2 states in the entire nation that wasn't funding public defenders, which was negatively impacting our criminal justice system. Democrats, Republicans came together, and now we lost that distinction of not funding our public defenders. We do that work now. Why do I share that with you? Because in these times of heightened polarization, where it's hard to have a conversation, heck, it's even hard to have a conversation at family dinner tables sometimes. Here in Pennsylvania, you should be proud of your lawmakers for putting aside differences on issues where we can't find common ground and instead working on the areas that Pennsylvanians care about most and finding common ground and solving problems and putting Pennsylvanians first. This PBM law is important because of what it means for independent pharmacies, reducing drug prices across Pennsylvania, but it's also important because I think it shows the power of people coming together, finding common ground, and doing common sense things. And that is something all of us should be proud of. I know I am. And I'm grateful to Senator Ward, Representative Benham, and all of the elected leaders who made it possible. So thank you for having me here at Thompson's. I'm going to sign this now, and then we'll come back and we'll be happy to take some questions. Thank you all very, very much. Did we get Topper and Gregory?
Yep, I have all the volume.
It's not long unless the right people are standing up there. Ready? All right, here we go. Rep, that's for you. Senator, that's for you. Thank you very much. Ward is going to answer all your questions. We'll go back here. Now, I have never been in a press conference where a reporter got name-checked by one of the speakers, so clearly you're the local person who knows what they're talking about. I'm going to give you the first question if you have one.
I do have one, actually. One of the things when you read through the bill, a lot of it talks about studies for the future and what's going to happen, you know, after they can gather the information. But we've lost 142 pharmacies already. What's being implemented in the here and now to make sure that we don't lose another 140 before this sort of really gets its legs?
Yeah. Let me offer some brief remarks. I'll ask the commissioner to jump in as well. Obviously, knowing that this law was coming about now, having it in law should hopefully give peace of mind to an independent pharmacy that's struggling and holding on, really for the reasons Senator Ward talked about before. Just the whole dynamic of how the pricing was working against independents like Thompson. Knowing that that's changing, knowing that they can no longer have business steered away from them, knowing that they're going to now have power in this conversation and have a place to go to in the insurance commissioner's office to be able to log a complaint that he can do something about it. Hopefully that's going to give peace of mind to reverse this trend. We also, I think, are in a position, thanks to this budget we passed with some historic investments in economic development, to be able to make investments in main streets like this and the businesses that line it, pharmacies and otherwise, to be able to strengthen our small businesses in our communities, especially our rural communities. Small businesses are the lifeblood and really the engine of communities like Hollidaysburg and others, and we are prepared to make more investments there thanks to the bipartisan budget that we're able to pass. Commissioner, you want to add anything on that?
Sure. Just to the governor's point, the effective date on the reporting piece was 2026 because you need an opportunity for the provisions to take effect. So over the next several months, you'll see the clawback provisions, the steering provisions, the specialty drug list with a complaint process for independent pharmacies and other pharmacies will all be taking place over the next couple of months. So you'll see these contracts changing with the local and independent pharmacies with the reporting a year later so that we can see the effect of the act itself.
Let me just add one other thing. When we've been able to give the insurance commissioner greater power, industry has very quickly caved from their predatory practices. When I took office, I challenged the insurance commissioner to be very aggressive about something called mental health parity, to make sure that our mental health care system, which by law should have parity with our physical health care system, that plans that came forth to his office would have actual parity in them. Otherwise, they would not receive approval. Even before the effective date of that came up, insurance companies were already running into the insurance department under Commissioner Humphrey's leadership and changing their practices and making sure that mental health parity was something that they were adopting quickly. Why do I share that with you? Because when lawmakers stand together, when laws are signed, when we send a clear message about what we're willing to tolerate and what we're not, in this case, we're not willing to tolerate the predatory practices of PBMs, practices change. And the people who will benefit from that are everyday Pennsylvanians, because their drug prices will go down, and of course, independent pharmacies like this. Anything else from the media? Yeah.
Can it be on another topic?
Let's see if there's anything else on this. Anything else on this? I was afraid there wasn't. Anyway. And I'm not going to be offended if Senator Ward walks away for this. Go ahead.
The first one is one that you've obviously gotten a lot. Have you spoken with Vice President Harris since Sunday, and have you been reached out by your team in regards to any vetting materials?
On Sunday, I was really honored to receive a call from President Biden just a few moments after he made the announcement that he was dropping out of the race and endorsing the vice president. Vice President called me just a few moments after that. I quickly offered her my endorsement. We spoke only about that, and we have not spoken since.
Can you say, we know that tomorrow you're going to be holding an event in Carlisle for her, as well as on Monday with Governor Whitmer from Michigan. Can you tell us anything?
You know my schedule better than I do.
Can you tell us anything more about what these events will entail?
I can't, but I can just, not because I'm unwilling to, but because I just don't know the details of the events, other than I'm going to stand up and speak very forcefully in support of Vice President Harris and talk about the clear contrast in this race between she and Donald Trump. Anything else? Yeah.
Of course, this measure that you took with this bill is helping to protect access to healthcare and prescriptions in our local pharmacies. What steps are next as far as protecting women's healthcare within our local pharmacies?
Something went off.
Access for women's healthcare, things like birth control, mifepristone.
Absolutely. Look, I've always been a champion of women's reproductive health care and freedom for women all across Pennsylvania. So long as I'm governor, women will have access to mifepristone. They'll have access to abortions here in Pennsylvania. They will have access to any health care that they and their doctor choose, free from political interference. That is a commitment I've long made to the good people of Pennsylvania. I've long honored, whether it was as Attorney General going to court to defend women's rights, or making sure that our pharmacies and our doctors are able to practice medicine and healthcare free of political interference. So long as I'm governor, that's going to continue. Okay? Thank you all very much.
Can you tell us a little bit about your weekend of action for Kamala Harris for president and what areas you're targeting across Pennsylvania?
You know, here at Thompson's, we love to talk about everything in the community, but I think we don't love talking about politics there, right, Bill? But out of respect for the question, I mean, look, I have a very clear view on this election, and I think this election poses a stark choice between the vice president and between Donald Trump. It's no secret where I stand on this, and I'm going to do everything in my power to prosecute the case as to why Kamala Harris is a better candidate, why we don't want to go back to the chaos of Donald Trump, and I'll be doing that in these rallies this weekend. Thank you.
Can you
Okay?
talk to just how the polls are getting that much closer between her and former President Trump, especially
I
just
think when
this?
it comes to polls, you should interview a pundit. I'm a governor for all Pennsylvanians. I'm going to focus on doing that job, and others can offer the punditry. Thanks, everybody. Appreciate it. Okay. Good job. Thank you. Sorry.